Hi everybody, this is Dr. Bulow with Revive Upper Cervical, and today we're going to talk about vertigo. Now, vertigo itself is not a full diagnosis. It's a symptom of, where the world is spinning, or you might get nauseous or feel a bit off balance. It kind of goes hand in hand with dizziness, but it's more of a visceral reaction and more of a where the world, your depth is changing and the world is spinning. And most people, when we think about vertigo, we could tie it to different diagnoses. We could tie it to, probably at its worst, is Meniere's disease. But at the same time, it's a very common symptom when it comes to the diagnosis of post-concussion syndrome. A lot of people with a concussion experience some level of vertigo. And so today what I wanted to discuss is why patients with vertigo very often do extremely well when they are cared for by an upper cervical chiropractor. What's the connection between the neck and the sensation of dizziness or vertigo? And so if this is something that you deal with, hang on and watch the video. If not, please still share the video, especially if you know someone that is suffering with a vertigo or a condition that has the predominant symptom of vertigo. So let's talk about that. Let's talk about your sense of balance. What most people don't know is that your sense of balance, your brain's awareness of where it is in space, is actually dependent upon three different systems. The system that most people think about when they think of balance is the inner ear, the vestibular system. That's a very fascinating and very complex system of neurons inside your skull on the right and left side that help and feed your brain information about where it is, where the skull is in space. It's also a very well protected system, so direct damage to the vestibular system, while it's probably the most blamed system, in my opinion, is probably one of the hardest things to actually damage because it's very well protected by bone. Now, the other systems that tell your brain about where it is in space would include the visual systems, your eyes, you see the world around you, and then there's the system that most people are unaware of, or they don't even realize, helps your brain understand where it is in space, and that is your proprioceptive system, or your proprioception. It's otherwise known as body sense. It's all of the signals that come from the joints in the body as well as the muscles in the body telling the brain where it is in relationship to gravity and space. Give you an example of proprioception. If I were to ask you to sit nice and tall and close your eyes and hold your hands out to your side and touch the tips of your fingers to the tips of your nose, without looking, without using the inner ear, your brain is able to tell where your body is through the proprioceptors, the signals, the little antenna in your muscles and in your joints, and tell your brain where your body is. Where your skull is head up by your neck and your spinal column. And those things also give huge amounts of proprioceptive input to the brain stem, to the brain, telling it where is it located. So now, how does someone get vertigo? Here's how they get vertigo. Usually they get vertigo when one of these systems does not agree with the other systems, giving the brain and the brainstem bad information about where it is in space. Let me give you an example of all three. If you were sitting in the Omnimax theater, right, one of those huge movie theaters, you're sitting still, so your proprioceptive, your body sense is telling your brain, we're not moving. Your inner ears aren't moving because you're looking at the screen, but your visual input when you're watching a very large movie screen, let's say of a roller coaster or a plane flying through space, your reactions, your body might think that you're actually moving in those situations and give someone a sense of vertigo. That's why in the big Omnimax theaters, they have those bags in case you get nauseous and need to throw up. Here's another example. Let's talk about the vestibular system for a moment. Let's say you're inside of a cruise ship going on a journey and you're on the inside cabin in your room and you're standing looking at the mirror and your inner ear is telling you that you're rocking from side to side. However, your proprioceptive input says, we're not moving. Your visual system, you're looking at the walls of the cabin inside the ship and you're saying, we're not moving. But the inner ear is saying, yes, we're moving. As a result, what happens? A lot of people can get motion sickness. They don't do well in planes, they don't do well in boats, they don't do well in trains, things along that nature. Now, let's talk about probably one of the most overlooked systems, the one that we deal with directly in this type of a clinic that very often can cause the symptoms of vertigo or dizziness, the proprioceptive system. All the muscles and joints in your spine, in your axial skeleton, are telling your brain about how your body is standing against gravity. And if someone has, say, a concussion or a whiplash injury where their head and neck are twisted and jerked around, very often they can be left with a misalignment in the neck. Now, if that misalignment starts to affect negatively the signals going into the brainstem, affecting the neurological connections between the brain and the body, we call that a vertebral subluxation. If that happens in the upper neck, now we're going to get the same misinformation where the inner ear has a certain idea of where the eyes are in space. The eyes are agreeing with that, but now if the neck is twisted from a subluxation, from a misalignment, giving bad feedback information into the brainstem, there's again the exact same disconnect, and the brainstem doesn't know who to believe out of those three systems. And when that happens, we very often can get vertigo or dizziness or nausea. So, if someone has been suffering with ongoing vertigo, chances are they've been to the vestibular therapy. They may have even gone to visual therapy. But if they've never seen a specific upper cervical chiropractor, then this is the opportunity for them to learn more about this, because it just might be causing their residual symptoms. Especially if in their history they had a history of a whiplash, a concussion that preceded the onset of those symptoms. When you start to see these things again and again, you start to put the pieces of the puzzle together and create a clear picture of what's really going on. So please feel free, if you have any questions, ask away. And if you know someone that's been suffering with a condition like this, please share away. We really appreciate your time. These videos are meant to be educational and transformational, and I hope they've been that for you so far. We'll talk to you next time. Bye now.